Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care as well as primary care. We assist busy professionals to find solutions for their acute and chronic primary care needs. We do this through our COVID-19 testing, COVID-19 vaccines, primary care, telemedicine, as well as concierge medicine. So good afternoon, ladies and gentlemen, and welcome to Let's Chat. Today's topic is about self-care. And we're going to hit a little bit about the recent meeting, the last meeting on Friday from the FDA, and the result of that, or what came out of that in terms of who they're suggesting a third dose for at this moment. So let's hit on self-care. September is Self-Care Awareness Month. And so during this month, one of the things that I've been doing is doing a little bit better job of self-care. My birthday was a couple of weeks ago, and that's always the time of year that I remind myself to make sure that I take care of myself so that I could be here for a little longer. Included in those things, we want to make sure that we're taking care of in terms of self-care, especially in lieu of what we're dealing with now in a pandemic, is making sure that we are getting our primary care visits in and our regular visits in with all the specialists that you may have that help to take care of you. In the last year, it's been COVID, so a lot of people have been at home, not necessarily gotten out unless you had to. A lot of people have forgone some of their screening tests and screening visits with their physician. I do want to remind those of you that have diabetes, that have high blood pressure, that have heart disease, their regular blood work, lab work screening tests that you need on a regular basis. Now, and I want to tie into that a little bit. One of the things that we talked about this morning on house calls was post-COVID conditions. Sometimes when people have had COVID, you can have issues or challenges with different organ systems. COVID can affect your body in so many different ways. In fact, I'll read off a little list now of some of the different symptoms that patients have and complain about. And when I say post-COVID conditions, we're talking at least 4 weeks after that first positive COVID test. People have complained about, we know fatigue, right? We could guess that. Pain, diarrhea. People have complained about having a loss of taste or smell that persists. They've complained about rashes, about dizziness, about sleeping problems, about fever off and on, about joint pain, muscle pain, headache, chest pain, all of those things, mood changes. In addition to that, there have been individuals that have been diagnosed, have never had high blood pressure before, have never had high cholesterol before, and been diagnosed with those things after a COVID infection. So as part of a primary care visit, of course, we would check your blood work and check your blood pressure, monitor for different things, and make sure that you have all the appropriate screening tests that you need for your age. But in addition to that, we're going to check some blood work on you. And after someone has had COVID, we went over that entire list of symptoms. Some of these things are happening in individuals in about 9. There's a study that they did, a post-COVID study that they did in a scientific magazine quoted this, but 19% of people that started off having no COVID symptoms at all, they were completely asymptomatic. 19% of individuals from this particular study, of the 300 people they studied, 19% of those people actually reported symptoms, signs, issues, problems with post-COVID symptoms that were related to COVID, and they didn't necessarily have symptoms to begin with. That's another reason why you want to make sure that you get that primary care visit in, to make sure that we've checked our lab work. If it's time for you to have that mammogram, we want you to get that. If it's time for that pap smear, your colonoscopy, for your prostate check, we want to make sure you get all of those things. So we don't want to forego our primary care in this time of this COVID pandemic. And most physician offices have transition themselves and being able to see you in a very, very healthy way that doesn't put you at risk or put other individuals at risk for catching COVID. So definitely don't forego that. Last thing we want to hit before we get out of here. So as part of self-care, we want to make sure we get our primary care visits in. We want to make sure, in addition to that, that we spend time with our families. Spending time with your family or the people that you love has shown to improve people's mood. It is improved Even disease processes for some people, just them being around their family can help with that. So we want to make sure in this time that we're having to, kind of isolate ourselves and not be out as much, that we very safely visit family members, but that we don't forego the primary care of, or the self-care rather, of your primary care visits, of you visiting with your family, as well as making sure that you're taking care of yourself. Okay. So, and that's something I definitely am aiming to do a better job at. Sometimes I struggle with that. So last thing we want to talk about is this third dose that the FDA met about on Friday. So, excuse me. So they did not approve the third dose for everyone in general. What they did do was approve the third dose for anyone that is 65 years or older. We know that they already gave, we'd already started giving the third dose to those individuals that are immunocompromised. So anyone with autoimmune diseases, anyone chronic kidney disease, a whole slew of other things, and your physician would let you know if you fall into that group. But I've already started giving the third dose to those individuals and any other individuals we feel are immunocompromised. What they did do is okay the third dose for anyone 65 years old or older, as well as healthcare workers, and as well as anyone immunocompromised. Now, we definitely understand why, they would definitely okay it for healthcare workers, because the evidence has shown that the antibodies levels start to decrease anywhere between 6 to 8 months after that first dose of the vaccine. And so they're just trying to be very careful now. Part of the reason that they didn't approve it for everyone, if you look, and I know that there's a lot of confusion out about that third dose and them not approving it, and we definitely don't want that to contribute to any vaccine hesitancy. But part of the reason that they gave us, the reason that they put it off, had to do with some of the data. They wanted to see more data from Pfizer about what this third dose can do in general, in the general population. One of the things that they were concerned about and did go ahead and okay is that the antibody levels do show, some of the data showing the antibody levels start to decrease in that 6 to 8 month range, and definitely substantially by 8 months. So that is the reason for that. Now, what they did not say was that they were not going to approve the third dose for everyone. And so I just wanted to get on and chat with you guys about this part a little bit, because I know in all of everything we see in the media, everything that's talked about in relation to the vaccine, there are a lot of different opinions about it. And so just to provide clarity for my audience, for my patients, they didn't say that they weren't going to approve it for everyone. They just said they weren't doing so at this moment. They did, though, feel that anyone 65 years old or older should be going ahead and getting that third dose. Anyone that is a healthcare worker, or anyone who works around people that are COVID positive on a regular basis. So in other words, you're someone, let's say, you work in primary care physician's office. So you work with us. So we would recommend, because you're dealing with patients on a day-to-day basis, you have an increased risk of getting COVID-19. So they wanted to make sure those individuals got the third dose. So, and the next question I know that a lot of patients have had, so when are they going to approve the third dose for everyone? I do not know that. But I do know, just wanted to provide a little clarity on what they shared on Friday. And we'll see this week what comes out of the meetings. I know that there's a meeting with the CDC on this week. And I see Rochelle is on. She said she's had her third dose today. Okay, great job. Good job, Rochelle. I'm glad that you're getting that third dose to help to protect yourself as well as your family. So does anyone have any questions? Anyone have any questions? And if I can answer the question, I will. If I can't, then I'll tell you that I can't, or that I'm not certain. Anyone have any questions? I know it's been very, very confusing, but we're hoping that this doesn't ensue any vaccine hesitancy. There's nothing wrong with the vaccine in per se. They just didn't feel like they had enough evidence to show that everyone needed it at this point. Okay. Anyone have any questions? Any questions? Any questions? I know that I will be getting my third dose as a healthcare worker sometime in the next couple of days. Anyone have any questions? Any questions? I hope everyone is staying safe and learning how to navigate this pandemic and COVID water safely. Anyone have any questions? And if you didn't get a chance to see the segment today on house calls, today we talked about post-COVID conditions and the importance of a post-COVID physical. So take a look at that. I think that'll be helpful for you guys. Hey, Mr. Fisher, how are you? Okay, good. You got your third dose. Very, very good. Very good. And Mrs. Fisher. Okay, good. Tell her I said hello. I'm glad that you both got that third dose. Very happy about that. Anyone have any other questions? Any other questions? And I know it's a lot going on. I hope everyone continues to stay safe, and by all means, don't take that mask off when you leave your house. Anyone have any other questions? Any questions? Okay. So just as a reminder, hey, Kim, how are you? Thank you for joining us. He said, when can we get the third dose? Okay. When is the third dose officially given? Okay, Mr. Fisher, I misunderstood your question. Now, this is Junior. So you're Mr. Fisher Jr. So if you are 65 years old or older, then you can get your third dose now, depending on when you had your first and second dose, of course. But if you had it last spring, you're able to get your third dose now, as long as you're 65 years old or older. If you are a healthcare worker, someone who works with people or works in an environment where you're, potentially exposed to COVID, you can get your dose now. If you have any immunocompromised conditions, you can get your third dose now. Those are the only groups that the FDA has approved the third dose in. Other than that, it would have to be a situation where your physician finds that you're immunocompromised and feels like that you need it. Other than that, it's not open just yet to everyone, but we do anticipate that won't be long. I anticipate that won't be long, but we'll see. Anyone have any other questions? Any other questions? And if that wasn't clear, now, Mr. Fisher Jr., if that's you, I think you're junior and your dad is senior. Well, I know that that's how that is logically, but and you're my patient, so you know who you are. The question is really for Mrs. Fisher. Am I giving the third dose? I am giving the third dose. So I'm giving the third dose openly to anyone who is 65 years old or older, anyone who is a healthcare worker or works in and around COVID, and anyone who's immunocompromised. Yes, we are giving the third dose. You actually can get an appointment online. Mr. Fisher, I may have someone call. If that's Mrs. Fisher, I may have them. They're at lunch right now, but they may call you when they get back from lunch. I'll try and have someone reach out to you. Okay. Okay. Any other questions? So yes, to answer your question, Mr. and Ms. Fisher, yes, you can come and get your third dose. If you want to get it today, you can. Anytime after 2:00 probably would be good. You're welcome. Anyone have any other questions? Any other questions? I hope everyone is staying safe and learning how to navigate these COVID waters safely and with your family. They asked this morning someone asked when I thought that it would be over. I don't know. I have no idea. With the mix of everything that's going on, we need herd immunity. So we need more people vaccinated for COVID not to have a host to be able to live. And I'm not sure how long that will take, or if something will happen that, COVID will come into contact with something that will just make it die anyway. But only God knows that. So we have to pray and ask him about that. And I've been praying, so we should all continue to do that. Pray together. Okay. Any other questions? Anyone? Any other questions? Okay. So that's all we have for you guys today. I hope that everyone is taking care of themselves. I'm doing a better job of taking care of me and taking some time off for self-care. And in that realm, we will not have a Facebook Live on next Monday. We are taking a vacation day. But but I will come back to you live the Monday following, and we'll probably do a live later this week, depending on when that decision comes down. Because I do understand that it's kind of with everything that's going on, and the fact that, and you have to remember, the meetings that are publicized now and the outcome of the meeting, that's not normal for us for medicine. Like we're used to, you're kind of used to decisions are made kind of not behind closed doors, but it's not normally this publicized in the media enough to cause confusion about the vaccine. So we want to help provide as much clarity as we can and reassuring everyone that the vaccine is absolutely effective and safe. We know that it's helping to decrease hospitalizations. It's helping to decrease COVID deaths as well. And I'm not sure if you guys saw this. I saw an article this weekend that during 2020, there were over 64,000 deaths in the state of Alabama compared to the previous year of only 57,000 deaths. Now, about over 8,000 of those were attributed to COVID, but undoubtedly COVID has had an effect on the fact that there have been more deaths. There were more deaths in the state of Alabama in 2020 than there were births. So there are more people that died in 2020 than there were that were born, which is very unsettling and kind of sad. But anyway, any other questions, anyone? Hey, Miss Jones, how are you? Thank you for joining. But that's all I really had to share, guys. Just remember that. And again, the third dose at this point, the FDA has approved them for everyone that's 65 years or older, all healthcare workers, in addition to anyone that is deemed immunocompromised by their physician. And I want to just encourage you to still have faith in the vaccine. It's obviously working, as if you'll compare and you talk to friends, and or if you follow the data and follow the science, people that have been fully vaccinated have decreased severity of symptoms, decreased number of hospitalizations, decreased numbers of death. So the vaccines are working. We don't want the information they're sharing to cause any confusion. And so that's why we're just kind of just clarifying that for any and answering any questions that any of our patients have or that anyone else may have. But what we want to make sure that we don't do is tackle on confusion to it or give anyone the wrong idea about the vaccine. Okay. Any other questions? Okay, guys. So I'm going to hop off of here and try and grab a bite before we start back this afternoon. If anyone has any other questions, you can leave them in the chat. If you're in need of COVID testing or COVID vaccines, you can reach us for an appointment on our website at drcelestec19.com. That's drcelestec19.com. Or you can give us a call at 205-291-8842. We also are accepting appointments for primary care. You can give us a call at 205-291-8842. You have to schedule those directly with our office. Again, stay safe. Please continue to remember social distancing, washing your hands, and mask wearing is effective in decreasing the spread of COVID-19. That's all, guys. Have a good day. Bye-bye.